This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. Today's guests are a family team of optometrists. They are compassionate and skilled optometrists who provide full scope eye care with strong emphasis on dry eye treatment. They co-founded their practice in Houston, making them the first business owners in their family. For the past 10 years, they've built a loyal patient community and a strong values-driven team. They are co-owners and optometrists at Pro-Optix Optometry and Dry Eye Center. Please welcome Dr. Sairah Malik and Dr. Sairah Malik.
Hi, thanks for having us.
Thank you for having us.
Yeah, this is a bit of a unique experience. This is the first family team or sister team that we have on the podcast. So I'm excited to see where this conversation goes. And so the first question I'd like to ask everyone, what was the most important thing that helped you build your empire?
So I will start. What helped us build our empire is, choosing a specialty that we really believed in. When we started off, we were kind of the jack of all trades. We were dabbled in a little bit of everything. And I think choosing a specialty really, and really committing ourselves to it really helped us become leaders in the field and experts in the field. And we were able to provide, the best care for our patients.
Sairah, what do you think was your perspective on that?
I think that what's helped us kind of grow is innovation would be a good word. I think just we've constantly, strived to provide the best technology. We've never been sort of complacent and just, the initial investment that we made, we've always changed and we've always innovated and reinvented ourselves and kind of kept up with the latest in technologies. And so, we're super excited. We're probably one of the only ones in this area who have all the technology that we do have, and we're able to treat a wide variety of dry eye disease.
So specialization, technology, can you share with me a story in your business where that made an impact? Like, was there an inflection point? Share with the audience a story of how did that turn into reality? How did it help your business? Is there anything you can think of that like that?
I think that what's helped us, personally, first of all, I'm a dry eye sufferer, so I feel like that was a big motivating factor. I could relate to a lot of people. First of all, dry eye is an extremely underdiagnosed, undertreated disease, in the world. And so there are thousands, millions of people that suffer with dry eye. We hear this countless times on a daily basis that, oh, no one has ever addressed our dry eye like you guys have. So it's a very, very underdiagnosed disease. And the fact that I feel like I have dry eye, I think Sana suffers a little bit from dry eye. So we both we take those complaints very seriously. We want to find relief for these patients. If you truly have dry eye, it does affect your life. And so treating these patients appropriately and bringing them relief has been life-changing for our patients and for us. We love hearing that you've changed our life, and we didn't think that there was any treatments for this before, and so that's been great. And I think that's helped us grow because obviously if we're providing relief for something that's severely underdiagnosed, then they tell their friends or other people who have dry eye. So it's just kind of a snowball effect.
Yeah, it builds trust.
Yeah.
It builds trust with patients, and with that comes patient referrals and building the practice up.
So it was like a snowball. Like, you started to specialize, you got good at it, you fixed people's problems, and people started referring, and it just grew snowball from there. Is that what happened?
That's essentially what happened. Like Sairah said, we kind of slowly got into it, started adding more technology, and with that, treating those patients that were going to multiple doctors at that point, saying that we're suffering, we're not getting any relief, there is no treatment, and educating them that there are actually treatments out there, and kind of building on that. We started with one machine, starting very, very slow, and we started kind of adding on to that. And I mean, today we've got it all. We've got all the fancy technology, all the machines, and we're really able to treat our patients with the best technology
Yeah.
there is out there, giving them options,
Yeah.
giving them different options that weren't there before.
Yeah, I know a lot of folks listening are doctors, so they're probably familiar with RF, IPL, low light therapy, right? The usual Mibo flow, or LipiFlow, or all these other red light therapy. Yeah, and so I imagine you guys have all that as well, correct?
We do. We have probably everything. Yeah,
Yeah, yeah.
everything that you mentioned. Yes.
So why dry eye? Why not one of the other specialties like myopia control with kids? You could do families. You could do glaucoma. Why'd you guys pick dry eyes?
I think that our demographic it just happened due to the demographic that we see, the location that we're in. We see a lot of, young professionals who are on screens all day. We see, their children who are also on screens all day. So, it just kind of fell into, it was an appropriate thing to get into just based on our demographic alone. And then again, we're passionate about it because we suffer from it. So, yeah, so we just it kind of fell into our lap, but we also, think that it was appropriate based on the demographic that we see. Yeah, we also do
Yeah.
myopia management, but we just do more of the dry
Dry
eye.
eye.
Yeah.
We don't see a whole lot of
Makes
kids. The
sense.
demographic, it's like she said, it's young
Yeah.
professionals. So definitely, I mean, we just don't have those patients to do the myopia management.
Well, I think that's important to understand too, because you have to serve your audience. I think roughly in especially dense populated areas, it's about a 5-mile radius is kind of the max. Like Houston's you're probably pretty densely populated. More rural, it's a little bit larger area. You got to service different types of patients. But in cities, yeah, I think that's a really good insight of, hey, know who your audience is, know who your patients are, and service to them. So some places it might make sense to do more myopia control if you're more of a growing like family place. So
Right.
that's interesting
Yeah.
insight. As far as your let's talk if you're comfortable, let's talk some numbers. Like, so most folks when they do dry eyes, they do a comprehensive, and that's usually a feeder for ocular surface exams, which is a feeder for dry eye treatments. Do you all do something similar to that?
We do. We screen all of our patients for dry eye.
Yeah. Yeah, yeah, I know, and, you do the, mybograph,
We do.
where you're looking at the meibomian glands,
Photography.
yeah,
Yeah.
those are really cool. Yeah, mybography,
Yeah.
yeah, thank you,
Yeah.
mybography. I'm not a doctor, I just play
That's
one on TV, so, uh
yeah.
so the my and then do you have like a ocular surface type exam or dry eye evaluation that's after that, and you dive deeper, or do you jump straight into treatment? Like, can you talk about your
Yeah.
process of
So
how you execute this?
every doctor does it a little bit differently. Like some just focus on their comprehensive and then bring them back for their dry eye eval. We typically do a comprehensive, in their comprehensive exam, we address their dry eye. And because we do a mybography on everyone as a screening, we feel like it should be standard of care. I mean, to me, like, how do you address dry eye if you don't know, what their glands look like? You know, for me, that's a really important part of the whole thing. So we screen everyone and we address their dry eye at their visit. I mean, I feel like they're in our chair, and what better time to do that than now? And bringing them back sometimes feels like, um, a little bit like they may not come back, or there's several things that convenience wise,
Yeah.
whatever. So I just feel like it's the time to talk to them is when they're in your chair, and if they're complaining. So we do all the testing the day of.
I think educating them at that visit is really important too, because like we said, a lot of patients just don't have that education. They don't have the awareness that there are treatments out there to treat dry eye.
Yeah.
And so addressing it at their primary visit, I think, is really crucial.
Interesting. So when you do the evaluation, how long are your exams? Because if you have scheduled 10, 15-minute exams, like some offices, that's hard to get into the education piece. Do you do like 30-minute
I
exams?
was just gonna throw that in there that like we, unlike a lot of other clinics, are not super high volume. So I know it's difficult for super high volume clinics to do everything on the same day. So, and I completely understand that. So we don't have high volume. We schedule, 30 minutes for each patient. So we have enough time to address that. Now, if we do become a little bit busier, maybe that will change. But I think that we would like to keep it where we have enough time to spend with each patient to educate them about the dry eye in their initial visit.
Excellent. And what kind of whatever you feel comfortable sharing, what kind of conversions do you get? Like the number of people you identify have dry eyes, they have a speed score that indicates it. They also have they're symptomatic or asymptomatic. Um, of the ones you consider, hey, these are potential dry eye treatments that we need to educate. How many of those people convert into treatment of some kind?
Oh, I don't have any, yeah, I don't have an exact number, but I would say
Okay.
over, for the patients who are go through the myography and get identified as dry eye patients, I would say probably 60 to 70% of them end up doing some sort of dry eye treatment. I mean, that's
Mm.
not always, it's never cookie cutter, right? It's always like very,
Yeah.
very dependent on what they do. So that could include like, yeah, prescription eye drops. That could include like just all over the counter therapies. That could include our aggressive, treatments in the office. So if it's including all of that, I think 100% of patients who suffer from dry eye do something that we offer.
Okay.
Yeah. But as far as like
I
the
Nice.
think,
treatments,
Yeah.
like treatments are probably around 60, 70%.
yeah, if they're
Okay.
symptomatic, they're definitely more inclined to go ahead
Yeah.
with the treatment plan. Whereas if they're not symptomatic, it is a little bit harder to convert those patients.
Those are pretty good ratios though. Folks are, even if 60% getting treatments of some kind, and the treatments usually start around 100, 200 each, right? And so that can be that's pretty good. Showing the value. And it's a lot of these, the dry eye is one of those things that you can actually fix, which is nice,
Yeah.
or come close to fixing
Yeah.
completely.
Manage.
Yeah,
We say manage.
manage it
Yeah.
well. Yeah. Yeah, yeah. I guess technically, yeah. If I'm being proper, again, not a doctor, but yeah. Manage it
Yeah.
effectively, yeah. Uh, as far as, now you all were just mentioning that you're growing into a bigger facility. Um, what are some of the pains that you had as you grew your practice that you didn't expect to run into?
Few things. I mean, space was one. Now that we have, you know, the IPL, we've got OptiLift, we've got all these things. Space was an issue, so we're expanding. We're now in our new office, opening up. There's going to be a spa room in there where our treatments will be done. Another area where we've kind of struggled is just growing our team and finding team members
Yeah,
that share or understand our vision and understand what we're trying to do with this vision. Um, I mean, struggles with just even, finding referral sources and trying to funnel those dry eye patients into our clinic and brainstorming different ways to get those people into our office, whether it be from plastic surgery offices or dermatology
mm,
offices, other optometry offices, just finding different avenues of getting those patients.
yeah. That's, Saira, did you have a different perspective on that? I'm curious what are challenges that you face that you didn't expect?
Yeah, I think that the biggest challenge is how do you build awareness, right? That we have all these fancy toys, we have all the technology, but like, how do we get the word out? I think that has been the number one biggest challenge is like, where do you spend your marketing dollars? Like, how do you get the word out? Like, what is the most effective thing? Like, I think that everyone and every business owner would probably agree with me that you could dump endless amounts of money into SEO. But how do you gauge if that's working, if it's not working, but it's a necessary thing? So, like for me, that's been the biggest challenge is that yes, we have all of this, but how do we market it to the masses? Or how do we market it to our target demographic, which is very difficult to do, I think, in a big city like this.
That's interesting because I remember you mentioned that you started off doing a lot of things,
Yeah.
so it's probably expensive when you advertise everything and you go, inch deep, mile wide versus going mile deep, inch wide?
I was gonna say that has definitely been a struggle. I think that since we have specialized now with dry eye, it has been a little bit easier to target market those people. I think just marketing in general, like Cyrus mentioning, is just it is a deep black hole. You just dump money into it and you don't really know what you're getting back.
It's a pit. Yeah.
Yeah. So
Yeah.
that for sure is a struggle.
Sorry, do you have anything else to add?
Yeah.
Just curious your perspective
Yeah,
on it too.
just that like there are tons of optometrists in the city, right? Like every few blocks you'll find an optometrist. So how do you differentiate yourself, and how do people know that what we offer is going to be a different experience than going to another optometrist that will that won't have all the dry eye treatment. So how do you like present yourself that way? That's been a challenge because not all optometrists are the same. Yeah.
Yeah. Yeah. That I definitely feel that being in another competitive market in
Yeah.
Atlanta. So it's always
Yeah.
fun. And everyone's friendly with each other. It's not
For
like it's
sure.
bad
Oh no,
blood.
100%. Yeah, we have our colleagues referring to us, the ones that don't like to manage the dry eye or have difficult
I just
patients that are challenging, and they send, and we love that. And we love the cross referral system in the optometry community, which I think is needed. Like if you look at the dentistry community, I feel like they refer to each other a
Mhm.
lot. And we don't see that a lot
Yeah.
in optometry, but we're starting to, which is nice.
And so I'm curious, what are some of the challenges you all face as siblings working together? Like, what did you run into that you didn't expect there?
It hasn't been bad. We don't work on the same day. We never
Yeah.
work on the same day.
Okay.
We have our own clinic days, which I think is helpful. I know people always ask us that question. They're like, "How do you work with family?" But yeah, we both know what our strengths are, what we bring to the table, which are very, very different. Our personalities are very different. So
Right.
I mean, I think also the dynamic. I mean, she's a little bit, there's an age difference between us, and just kind of having that, I don't know, it just works. We, Sairah handles one aspect of the business, I handle another aspect of the business, and so there's really no cross contamination, I guess, and it works.
Yeah. That's cool. And did it always work like that, or did you guys just struggle a little bit to get there? Like, I'm curious. Did it just come out like you guys hit the ground running that
I
way?
mean, there's been, I mean, obviously it's not all like, all cupcakes
Yeah.
and rainbows, but like there's been challenges, and we've kind of learned to identify those and tweak some things and making sure that everything is smooth. So yes, challenges are definitely there. They're always there, but
I think that's working with anybody.
yeah,
Yeah.
that's working with.
Yeah. I think you said something insightful. It's like, hey, we have our own lanes that we stay, like
Right.
literally and figuratively.
Yeah, yeah,
You have your own lanes that you practice
yes,
during the day out.
yeah, yeah,
Not like you're sharing your lanes.
yeah,
Yeah. Um, So as far as I'm curious, I want to step back a little bit, get into the psychology of your ideal dry eye patient. What does a dry eye patient say to you? Like, what are some of the words that are like, oh yeah, this person needs our help?
There's multiple words that they can use, whether it's, I have fluctuating vision, I have watery eyes, my eyes feel dry, my eyes are
Mhm.
sensitive to light. I mean, there's an array of things patients can say that will, you know, fly it, you know, give us that red flag of, okay, this patient needs to be worked up.
What are some emotions that people have that are associated with those things? Like, how do they feel when like the person that comes to you? Like, what are some of the feelings they typically have that they're like, I need this fixed? Like, I'm curious to see that when it comes to like understanding your patients, that's important for me to understand is like the psychology and the emotional side as well as the complaint side or the presenting case side. So, yeah, what kind of emotions do you hear from
So,
people?
I mean, so we at this point see very severe type of dry eye most of the
Mhm.
time. Like the mild dry eye, will come in and say, my eyes feel tired. I've been, on the computer all day and
Yeah.
eyes are feeling tired, and, mild symptoms like that. And then we have the severe patients like who have maybe some autoimmune going on or things, and their life is miserable. They say, I am miserable. I can't survive like this. Like I need some relief. Like
Yeah.
so they're not happy. And so we see quite a few of those severe types. So they're not in a good place. I mean, having severe dry eye affects your daily activities. Yeah.
I mean, there's patients that are in depression because of their dryness, and so really, really affects them in multiple ways.
And I got to think sometimes the patients probably feel bad bringing that up. It's like, my eyes are just dry. I don't want to tell people I'm sad about it, right? And so that's probably like a stigma you might experience. Some patients might be. Do you find that people are hesitant to share that with you sometimes?
I don't think so. I think we have no, I think we have a pretty safe space in terms of like, hey, we're identifying some of these things, and they're actually have
Yeah.
they actually feel so relieved that someone has actually taken it seriously and is serious about getting it better.
Yeah. Instead of here, take some over the counter drops and
Yes.
move on, right?
Yes.
It's like, no, I have Sjogren's. This is awful.
Yes.
Yes. Excellent. And so I'm curious. You mentioned a little bit. Everyone's having challenges with staffing. How are you dealing with that? Like, are you? Is there anything that you're doing creatively to help with staffing challenges or retention of staff?
We've been through so much. I mean, we've now been in business over 10 years. We've seen it all. We've seen, staff theft. We've seen, we've seen it all. So I think going through those experiences really helped us identify what we were looking for, to build our team. And I think Sairah actually has done a really, really phenomenal job of screening our potential employees and bringing them in, trying to figure out, what their personality types are, what their strengths are, what their weaknesses are, and putting them in positions where they really can thrive. But yeah, that kudos to my sister for that. It's a tough job.
Sorry, do you use like a specific assessment or how do you do that?
Yeah, I mean, I've learned a ton from, my mentors and my colleagues that have been through this in the past. So I've taken lessons from our own experiences, and then this advice from mentors of how to. I mean, there is no perfect process for hiring, but we definitely try to identify. I think personality types has been huge. Just learning the different personality types and which areas that they can do their best, and then also just providing the culture, right? It's not all about who you're hiring, but how you are treating your employees and how the culture is in the office. And I've just learned a lot about that. And there's been a huge shift from when I started. The culture was very different. Like there was no culture. It was like you go to work and you put your game face on and that's it. And then, but now, the culture is different, and we have to embrace that. Like we need to, and I feel like it's a constant learning process, but it's been fun, and we enjoy the employees we have now, and we like to see them grow. And
Let's talk specifics because people that want to, they're also running optometry offices. So let's get a little more specific. How do you assess the personality? What do you do to build culture? Like specifically, how do you implement this?
so we have personality tests that we have everyone take after they interview.
What's it called?
Ugh, I knew you were gonna ask me that.
I tested. Yeah. Yeah.
I was trying to think of it while you guys were talking.
Did-
I'm like, I know this, but I forget.
I'm looking for it.
While Nana's looking it up, yeah. What are some other things like? Do you have a special way of interviewing? What's that process look like? How do you build the culture
It's
when they get on board? What do you do
it's
there?
the Myers-Briggs.
Myers-Briggs.
Okay,
Okay,
yeah.
gotcha. And do you look for sorry, real quick question on that. Do you look for certain personality types, or you just want to know what Myers-Briggs they are?
No, we just want to know like what
Right.
their personality is like, so that way we know how to, you know, talk talk with them. Yeah, and what motivates them and what keeps them motivated and happy at work. So I think that part is important for them.
We have we have I mean, we've got Gen Z, we've got millennials, we've got uh, Gen
Xers
yeah,
probably.
I mean,
Yeah.
we've got it all.
And on top
So,
of that, they're all
you know,
women. All women.
and we're all yes. So really trying to understand, how everyone works best,
Mm.
what type of environment everyone needs to really thrive, right? So it's I mean, for one person it may be giving them that raise to, you know, get them to feel motivated, and for another it may be, that whole team building, just spending time together and creating that office culture. So it's really just trying to figure out what works best for who.
Yeah. No, that's pretty cool. And It sounds like you just ask them, right? You do the Myers-Briggs, it sounds like you just ask them through the process, you just learn who they are about people, like
I
people.
agree.
Because that's difficult.
Yeah, I
Yeah.
agree. It's an art to read people and know what makes them mad and what makes them happy and what it yes, they can fill out that personality test to get a general idea, but really it's when you get to know them, you can tell, okay, this is where they're going to work best. This is the department that where they're going to work best. So it is you have to hire very carefully, but at the same time you can have the absolute perfect person on the interview, and then they start working and you're like, this is not gonna work.
What happened?
Yes, but then you can have someone who
Yeah.
gives you the absolute worst impression and you take a chance on them and they show you, they just blow you away. So I've had both sides, and it just like for me it's difficult to be like, okay, this is if you do the XYZ, you're gonna get the perfect employee. I personally don't think that works out every time.
Yeah.
Yeah.
Interesting. I like that approach. And so it sounds like you put a lot of effort into this, so to keep staff and create that cohesion.
Yes, it's definitely a work in
Yeah, tea
progress.
time. Cyrus created
Yeah.
a little tea time for everyone during
Tea-
work.
Well, so what is that? Tell me about that.
Yeah, if we ever have some downtime, I just like tell everybody it's tea time and we gather in our little break room. We have a little cup of tea. We all just talk about non-work related things and we
Okay.
just kind of blow off some steam if we're having like a rough day and it just seems to calm everybody down and everybody comes back like full throttle in their jobs. And so I feel like it's nice and everybody looks forward to that. They're like, when's our next tea time?
I like that because it's random.
It's very random.
It's not.
Very random.
Yeah. So it's like a surprise. It's not like, oh, it's gonna come every Wednesday. It's like, oh, maybe we get it, maybe we
Yes.
don't. It's like so it's like a gift.
It's actually kind of fun. It's fun because now whenever anyone travels, everyone will bring snacks for tea time. Whether it's like biscuits
That's
or
funny.
chocolates or different teas. So it's actually really
So
cute.
is it Earl Grey? Is it Indian cha? Is
We
there
have it all. We've got
It's a very international
okay?
tea time.
Fair enough. Whatever you want, right? It's
whatever
just gotta be
floats
tea.
your
And
boat.
maybe some coffee too
Yeah.
occasionally. Yeah. That's cool. So what do you, I'll ask this separately. What are you most excited about for the industry and your practices? So let's start off with your practices, with your practice first. What are you most excited about by the growth of your practice? And Sairah, I'll let you go first on this one, and Sana, I'll let you kind of follow up
Sure.
on that.
Well, super excited about the move to have to expand, have like more space to serve more patients. Very excited about that. I mean, we just added a new technology called OptiLift. We're super excited to get that going. That's something that we brought in just months ago, and it has
1 month ago. Just yeah.
1 month ago. Yeah, and it's done extremely well.
Wow.
We feel like it's helping a ton of patients. So I'm most excited about serving more of the dry eye community.
What is OptiLift? I'm not as familiar with that.
OptiLift is a technology by Luminous, and it is a RF and dynamic muscle stimulator. So it works on lower lid laxity. So as you get older, your lower lid starts to sag a little bit, and having a good blink is really important for meibomian gland dysfunction. And so it works on that. And then there's a radio frequency part of it that helps treat
Opens them
opens
up.
the
Yeah.
meibomian glands and melts the meibome. So yeah, we can combine that with IPL, and the results are phenomenal.
Oh, that's interesting. And the side effect is less wrinkles too.
Yes, the happy side effect.
And lifting and toning.
And lifting and toning, yeah. Yeah, I know most states, you have to have a medical license to do aesthetics. So I know that,
This
it's interesting that it treats.
It's an added bonus after we treat the dry eye.
That's really cool. So Sana, what are you excited about for your practice in the future?
I mean, I'm really excited about this move. It's something that has been a long time coming, and I'm excited to see what the future holds. I mean, we just added OptiLift, but who's to say something new comes out in the next few months or next year? So I'm excited to, add more to whatever we have here, just to see what opportunities come up for us now that we're on this journey.
And what are you most excited about in the industry of optometry in general? Son, I'll ask you first. We'll go the other way this time.
Now with everything happening with AI, I think that there's just so much that's, I think, unknown. I think I'm just excited to learn more about how AI can help us in our practice, help us grow, help us incorporate it, kind of stay up to date uh, with technology, and I think that's something that I'm looking forward to.
Should we find Sairah, how about you? What are you looking forward to for the industry?
Yeah, I think our industry has exciting things for the future. I mean, I just came back from a conference in Vegas, and it consists of plastic surgeons and derms and optometrists and ophthalmologists, and that was sort of the first time I saw like all of those specialties come together, working towards, something very, very common. Like they were there for aesthetics, but we were there for the dry eye, and everybody was learning from each other. And I just think that's kind of the first time that optometry has been able to collaborate with those other specialties because of the new technology that has come out. Before it was just like, yeah, you do your routine exam and get glasses and contacts, and that was sort of like that was it. We stayed in that lane, and now more and more optometrists. I mean, I listened to so many of my colleague speakers who were talking about all of this new technology they brought in, and then they're collaborating with derms and plastic surgeons because of some of the aesthetic things that are going on. So it's very exciting that we're able to have those collaborations now.
Yeah, that's pretty cool. Um, I think so. Like expansion of scope, right? Everyone talks about something around expansion of
Yeah.
scope, which is amazing, which is really cool to hear. Or AI.
Yeah.
Those are two
Yeah.
common themes that we're hearing,
Yeah.
or both. So let's shift gears a little bit. Let's talk about some of your personal journeys. I'm curious. I'll ask you to share separately, but it may be the same story because you guys grew up together. Can you give me a moment in your life you can remember that you would say, "Hey, this experience helped shape who I am." So it could have been when you were younger, it could have been more recent, but the experience that shaped who you are. And yeah, I'll let you guys think for a second. If one of you want, I'll let whoever wants to start first on this one.
Mine's pretty general, but I'll go ahead and start. I mean, we grew up in a family of immigrants. Our dad worked a corporate job, and we were three girls, and he really just raised us to be strong, independent women who were, completely self-sufficient, and really pushed us to do the best that we could. I think, so our third sister is also an optometrist. She works in Canada. That's where we're from. And I mean, the three of us will sit down and sometimes talk about it. And we always say that it's just really amazing how our dad came from, this small town and from overseas, and raised us to just kind of build this empire, as you say. So I think that definitely has shaped me for sure.
No, thank you for sharing. Sairah, how about you? Are you what's your
Yeah,
formative story?
so very similar sentiments there that Sana had, because I agree 100% that when I look back, um, there are some very defining moments that I think of when it was time to pursue a education abroad, or out of the country, or whatever have you. I mean, I feel like my dad, again, he came from a very small village where girls didn't really pursue a higher education, right? It was not common. So for him to really push us and encourage us, and not for what he wanted, he literally was like, I don't care where you go, what you do, but you just need to pursue a higher education. And he just like let us choose our own path and encouraged us in unbelievable ways. So I think I agree with Sana on that sentiment, that those are very defining moments for me that make us
Yeah,
who we are.
yeah. There's my parents immigrated too, so I'm not a woman, obviously. It was a different experience, but Similar stories about the education and wanting to drive. My wife as well, so it's kind of interesting to hear
Yeah.
that. So switching gears a little bit, Sairah, what advice would you give to yourself if you were to go back in time to 1 week after you graduated OD school?
I would say that don't be afraid to take risks. Like that's something that a lot of people I know and meet that freshly graduate and they're scared and they don't want to take the risk and they always take, the safe route and all of that. And I think that there's no better time than right after you graduate to take those risks and work as hard as you can and, learn as much as you can from your mentors and people around you and just be a sponge and just absorb everything. So my advice to myself would be to don't be scared, like to kind of experience the industry and like meet tons of people and learn from them. And you may not have the best experiences with some of them, but those are good learning lessons for your future self.
Exposure and risk. I
Yeah.
like that. Sana, how about you? What would you give your younger self advice of?
So for me, I think, yeah, immersing yourself in a business and learning the ins and outs of how a business runs. Because we go to school to be clinicians. We are not taught how to run a business. And so for me, the best advice I really could give anyone, stepping out of school would be to work at a practice and not only see patients, but to immerse yourself in the business side of things and, learn the billing, learn the optical, learn all the things you don't learn in school.
Yeah, those are really good. Those are both really good insights and advice. So thank you for sharing. So I want to give people a chance to connect with you. Where can people find you if they want to connect?
They can find us on Instagram. They can find us on, they can find me on LinkedIn. I think Instagram would be the best one. Our emails are on there. They can, direct message us, DM us, and we're very responsive on there. We respond right away. So that would probably be the best place.
Well, excellent. Well, hey, Dr. Sana, Dr. Sairah, thank you so much for being on the show today.
Thank you so much for having us.
This is a fun interview with the two of you all. And thank you, thank you, audience, for listening. If you learned something or laughed, share the podcast or the YouTube channel with a friend, and make sure you hit the subscribe button so that you never miss an episode. And use the HubSpot link or the meeting link in the show notes to book a meeting, and I'll send you a free copy of my new book, Optometry Redefined. Thank you again, Dr. Malik and Dr. Malik. This has been another episode of Optometrists Building Empires. See you next time. That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.